Hi, my name is Ada Willis, and I am here today to present my project. It's a capstone project on antibiotic administration, which is a big deal because antibiotics are something that we use a lot in healthcare, whether you're the provider that's prescribing them or the nurse making sure that the patients get them. And a lot of times antibiotics are either given too much, too little, or not given enough and improperly. And here's my PICO question. In perioperative nursing, how will administration and accountability performance regarding prophylactic antibiotics compared to no prophylactic antibiotic administration and accountability performance related to antibiotic administration demonstrate a significant decrease in overuse, underuse, and/or improper use of antibiotics after 3 weeks of the implementation of the antibiotics bundle? Why is it such a big deal? It's been estimated that 40 to 60% of surgical site infections are prevented with proper use of precautionary antibiotics. However, overuse, underuse, improper timing, and misuse of antibiotics occur in 24 to 26% of operations. It's been estimated by the CDC that there are 2 million illnesses as well as 23,000 deaths a year because of antibiotic-resistant organisms. So that means that antibiotics are being given way too much because there's all these superbugs coming out, which isn't good either. And here's my literature review. It's on antibiotic stewardship. The study is noted to be quasi-experimental. The study participants in intervention and comparison groups are very similar, and it's based upon 222 patients at the Johns Hopkins Hospital that are grouped together by healthcare-acquired infections, otherwise known as HAIs. The results of the study concludes that about 73% of hospital-acquired infections, the treatment deviated, which means it differed from recommended practices, which isn't good. So that means that they're not doing what they're supposed to be doing. And 25% of those patients were treated with too broad of a spectrum of antibiotics, so it wasn't specific to the organism for the patient. And 60% of patients received antibiotics way too long. The results support the proposed antibiotic administration bundle. The results indicate that antibiotic administration needs to be something that we all take accountability for, whether we're doctors or nurses. The second article I used states that it's a facility-based cross-sectional study, and it was based over the course of a few months. And the results noted that the antibiotics weren't given enough, and there was not a whole lot of compliance going on. And the results are going to help for caring in for the patients because it brings to light that they're not getting given enough. So antibiotic administration is definitely a problem. Best practices. The best practices are that the patients are getting the antibiotics in timely manner, and they also need to be given for the entire duration according to recommended practices, and discontinuing them after a certain time so that the patient does not contract C. diff or something else like that. The antibiotics bundle policy could help every facility in standardizing antibiotics treatment. And here's my references. Thank you very much for your time, and please take my survey and quiz on antibiotic administration. Thank you.